Hello everyone. Is everyone ready to begin?
Yes,
Yes.
I am
Yes, we are
ready.
ready.
Okay, let's start the discussion now. The topic of today's discussion is consuming dietary supplements is the best way to keep one's health condition. I think I agree with this statement. What do you think about this topic?
I'm sorry, but I think I have to disagree with you on that, Haja. From my point of view, consuming dietary supplement is not the best way to keep one's health condition because many supplements contain active ingredients that can have strong effect in the body. So our bodies are designed to absorb and use nutrients as they naturally occurs in food. So when we take in high levels of nutrients from dietary supplements, our vitamins and minerals start to compete for absorption, which can eventually lead to dangerous and nutrient imbalance. So according to the National Institutes of Health, some supplements can increase the risk of bleeding, or if taken before surgery, can change the response to anesthesia. So besides that, dietary supplements can also interact with some medicines in ways that might cause problems. So for example, vitamin K can reduce the ability of the blood in warfarin to prevent blood from clotting. So what do you all think about this?
I've got my doubts about it. From my perspective, consuming dietary supplements could benefit health conditions because some vitamins cannot be produced by the body. So, to get sufficient nutrients, you must consume dietary supplements. Let me discuss this topic on a specific aspect. For example, consuming dietary supplements choice in pregnancy, such as the uptake of folic acid and omega 3. First, folic acid plays an essential role in pregnancy because it ensures the woman meets the increased requirement for critical nutrients during and around pregnancy. It also helps the baby brains and spine. Taking folic acid both before and during pregnancy can help prevent neural irregularities such as anencephaly and spina bifida. According to the US, the Preventive Services Task Force, an independent panel of national disease prevention experts, recommends that anyone who is trying to become pregnant will start taking a daily folic acid supplement containing 400 to 800 microgram at least 1 month before becoming pregnant and through the first 2 to 3 months of pregnancy. In addition, omega-3 also plays an important role in the normal development of the baby's brain and may help premature birth and childhood algae. For instance, lactating women who receive 200 milligrams of DHA per day for 4 months have infants who perform significantly better on the Bailey Psychomotor Development Index for 30 months compared with women who receive a vegetable oil supplement. Also, fish oil supplementation taken during pregnancy and lactation resulted in a decreased risk of infant allergies. What do you feel about this, Farah?
I'm sorry, Haja, but I hold the same opinion as Amirul on how consuming dietary supplement is not the best way to improve our health. I have heard some stories on how people are diagnosed with kidney problems just because they consume pills to lose weight. I have a point to add. I believe that this practice will only lead to a a less healthy lifestyle. It would create the mindset of the consumers that their health condition is dependent on whether they are disciplined or not in taking their preferable supplement every day, or as how the direction in the back of the bottle states, instead of taking good care of their health in a traditional way.
I want to ask a question. Can you explain more on what you mean by traditional way?
Yeah, sure. In other words, to practice the actual healthy lifestyle the way the old people before us did. For example, making sure we eat a balanced meal following the food pyramid. Moreover, one should engage in physical activities regularly in order to prevent health issues like obesity, diabetes, and heart disease despite how busy their schedule is. In contrast, to say that never mind, as long as I eat this supplement, I will be in shape, is definitely not an excuse to skip exercises. In fact, the people back then could live up to 100 years just by having fresh fruits containing high vitamins as their only supplements. Indeed, supplements are just useless if compared to an actual actual healthy lifestyle. Now, is it crystal clear?
I think I get it now. Do you want to say that taking supplement is not necessary if the person already practices a good healthy life? I got it right, haven't I?
That is close enough, Yasmin. I wonder what Faris has to say about this topic.
I'd like to add some points here. I actually agree with Hajar's opinion regarding how dietary supplement actually help us to meet minimum requirement of a certain nutrient. And in my experience, dietary supplements can be used to improve physical performance during exercise, weight training in specific, where weight training usually involves breaking down the muscle and building it up again. So taking protein supplement may actually help to repair and strengthen the muscle tissue and also delay fatigue during the exercise. I believe this is very important for bodybuilders and athletes to make sure they are able to improve and maintain their performance. Dietitian of Canada and the American College of Sport Medicine actually recommend 1.2 to 2 gram of proteins per kilogram of body weight per day for athletes, depending on the training. And protein intake should be spaced throughout the day and after workout. I have read an article where 130-gram scoop of protein powder actually contain about 21 to 27 gram of protein. And that's the same amount of protein as in a 100-gram chicken breast. So I believe that dietary supplements are much more convenient and practical. It is much easier to consume a scoop of protein powder rather than cooking a meal because not everyone has the time to get up extra early every day just to prepare the healthiest recipe from scratch.
Well, sorry. Okay. So, well, you might be right, Paris. However, taking more than our body needs can also raise the risk of side effects. So, taking large dose of dietary supplement can be harmful because our body only needs those in very tiny amounts. So, for example, too much vitamin A can cause headache and liver damage. So, how about you, Yasmin? Do you have anything to add for our discussion?
Yes, I do have an idea to add. From my point of view, the concept of hypervitaminosis need to be taken seriously in these issues. I guess most of you must have overlooked it. So what is hypervitaminosis? Hypervitaminosis is a condition where someone takes nutrient in their diet that exceed their body needs, enough to give them a negative impact to their body. A dietary supplement contains a certain amount of micronutrient, and sometimes we don't even read about it or have enough knowledge to actually be aware and concerned about that. It contains a very little or quite high micronutrient, but mostly they contain a pretty high concentration of nutrition, since initially dietary supplements were created for a pupil who do not take enough nutrient in their diet. Then people started to be influenced by the idea of getting dietary supplement even though they don't need them. We all know that the requirement of consuming dietary supplement and the amount of nutrient that needs to be taken is based on individual's need. Therefore, if you are a healthy person and don't have any problem about your body's nutrition, then dietary supplement is the last thing you need in your daily life. I can give an example here. The amount of vitamin A that needs to be taken by adult women is 700 micrograms. And one of the impact of an excess of vitamin A is a birth defect to a fetus. That's very bad and need to be prevented. To sum up what I am saying, consuming another or an addition of nutrition can cause hypervitaminosis for someone who has taken enough nutrition for their body. Sure, you can take dietary supplement. It's not wrong, but it is a lot better if you can get advice or guidance from a doctor or dietitian first before taking any dietary supplement. So, what do you guys think?
Yeah, I think that is actually an excellent point, Yasmin. I have to agree to that.
I think all three of you have stronger reasons to be against the topic statement.
So now that we have seen things in the same way, we can all agree that consuming dietary supplement is not the best way to improve our health. Indeed, there is no shortcut to always stay healthy, right?
Yes, I'm glad to have this conversation with all of you. Thank you everyone for this fruitful discussion.